We are delighted to welcome Muhannad Kadi, who's the Chief Communications and Marketing Officer at the KFSH. Welcome.
Thank you.
So we've had an interesting discussion this morning at the launch of the latest brand finance report into academic medical centres. I think, the first question that springs to mind really is, why should a hospital have a brand?
It's a logical answer. The things that I have been asked myself before I joined KFSH, why they want some caliber like me. And I then realized that their mission is to challenge the status quo of the healthcare industry for the better of the humanity. The hospital have been a global and a regional layer, sometimes at the global level, treated 25% of Saudi oncology patients, contributed to 10% of genetic rare diseases, and one of the leading transplantation center across the globe. However, our owner have challenged us to look about the next 50 years, how we can sustain ourselves, or sustain the performance that we are doing by being sustainable, financially sustainable, and to serve more patients from Saudi and from outside Saudi. Increasing the clinical trial, because the clinical trial is a major element in AMC, where they thrive and their contribution in the world. And finally, adoption of new technology and creating a new one.
That's great, thank you. So let's take a different tack then. Thinking about the brand finance ranking this morning. Okay, so let's take a different tack then. So thinking about the brand finance ranking that we heard about this morning, why does a ranking like that of academic medical centres really matter?
It's an interesting question. Before I joined KFSH, I remember my first interview with my CEO. I asked him, why do you need someone to handle your brand and marketing does not have any medical background? And his answer was, I need someone outside of the system that have not influence, that will not be influenced by the achievement. Rather, he knows the language of the people or patient and will really focus on the impact. Those rankings, or those what you call it, marketing materials, help us in having more collaboration with international society or international partner across the globe. This have been proving from the day I joined until today. We have increased our portfolio with the partnership with world leaders such as AstraZeneca, Eli Lilly, Roche, and many others, that led to a breakthrough achievement. We have performed world first robotic surgery on the brain, on the heart and liver. That cannot be done without this partnership. Also, we have invented some kind of cancer treatment with 25% lower than the market. You can name the breakthrough, the amount that we have increased in number of clinical trials, number of patients outside KSA that want to treat us. And this is because of the publicity that we have from such rankings.
Fantastic. So, you mentioned that the work that you're doing, is relevant in Saudi and, more globally, but we live in economically constrained times, and I wonder if that has an effect on the purpose or the role of the hospital.
So today, healthcare is not like any other industry. It's focused about saving life and improving the quality of the patients, quality life of the patients. And to do that, you have to have a partner, whether it's local or outside, with different government, different individual and government entities. We are lucky to work under the Saudi health ecosystem, where there is more collaboration. This more collaboration have decreased the amount of bureaucracy, more efficiency and more rapid. And I will mentioned something that the time that's spent to have a clinical trial of feedback is much faster than anywhere in the world. In fact, we promised that we will have it within 30 days. This will let this have been notified by the Royal Court, where they give us a grant fund to build our GMB facility. This GMB facility will help others across the globe to conduct their researches or clinical trial in Saudi. So the more collaboration that we have, the more outcome that we will have.
Thank you. So collaboration, not competition, is the order of the day.
I agree, and we have to focus that brand is not about visibility or recognition. It's about providing better care, better transactional research, and better outcome. We have to understand it's not about personal glory, it's about what really matters to the patients.
Thank you so much.
Thank you.